How do bone cancer prosthetics connect directly to bone? When someone loses a limb due to bone cancer, regaining mobility is a vital part of recovery. Traditionally, prosthetic limbs attach to the residual limb using a socket that fits over the skin. While effective for many, this method can cause discomfort, skin irritation, and may not work well if the residual limb is very short. That's where a newer technique called osseointegration comes into play, offering a more direct connection between the prosthetic and the bone itself. Osseointegration is a surgical process where a metal implant, usually made of titanium, is inserted directly into the remaining bone of the amputated limb. Titanium is used because it is strong, lightweight, and biocompatible, meaning it is unlikely to cause an adverse reaction in the body. During the procedure, the surgeon drills a small hole into the bone and inserts the titanium implant. Over the next several months, the bone gradually grows into the surface of the implant in a process called osseointegration. This creates a very stable and strong bond, essentially turning the implant into part of the bone. Once the bone has grown into the implant and healing is complete, a component called an abutment is attached to the top of the implant. The abutment extends through the skin, creating a direct connection point for the external prosthetic limb. This connection allows the prosthetic to be attached securely without the need for a socket that fits over the residual limb. The entire process usually involves two stages. First, the implant is surgically placed into the bone, and several months are allowed for the bone to grow into the implant and secure it firmly. After this healing period, a second surgery attaches the abutment, which protrudes through the skin. Following this, patients undergo rehabilitation to learn how to use their new connection effectively. For patients with high-level amputations, such as above the knee, osseointegration can be especially beneficial. It often results in increased comfort, better stability, and a more natural walking pattern. Many patients report less pain and skin problems compared to traditional socket prosthetics. The direct connection also improves proprioception, which is the sense of where the limb is in space, helping patients feel more confident and mobile. In the United States, the only FDA-approved system for this type of implant is the OPRA implant system, designed specifically for above-the-knee amputations. It is available at specialized centers and is considered for patients who struggle with socket prosthetics or experience discomfort. However, like any surgical procedure, osseointegration carries some risks. The most common complication is infection at the skin-implant interface, but with proper care, these infections are usually manageable. It is important to remember that not everyone is a candidate for osseointegration. The decision depends on individual health, bone quality, and other factors. Because it is a complex surgery, a team of specialists including orthopedic surgeons, prosthetists, and rehabilitation experts work together to determine the best approach for each patient. In summary, connecting a prosthetic directly to bone through osseointegration involves surgically inserting a titanium implant into the residual bone, allowing it to fuse over time, and then attaching an abutment through the skin to connect the prosthetic limb. This method can greatly improve comfort, stability, and mobility for those who have lost a limb due to bone cancer, but it requires careful evaluation and expert surgical care. As ongoing research advances, osseointegration may become an even more common option, offering new hope for improved quality of life after limb loss. Always consult healthcare professionals to explore the best options tailored to individual needs.